Thank you. Thank you very much for the introduction. And I just wanted to say a special note of thanks and recognize John Lister for his work, because he has not only done the work with you here, but has come to Canada multiple times to help us fight PFI there and to help us fight local hospital closures and consolidations, much along the lines of what I've heard from you here today. I found some great inspiration from your local campaigns and also from the commonalities of what we face across the Atlantic from you. I wanted to tell you a little story, though, to start, because I thought you might be interested. Senator Bernie Sanders, do you know who that is? Oh yeah? Okay. So about a week ago, we had him at the University of Toronto to speak about what the US could learn from the Canadian public health care system. And in his speech, he told a story that might be somewhat familiar to you. He said in 1945, after the terrible suffering of World War II, the British Labour Party was elected. And he talked about a man named Nye Bevan, who at the age of 13 left school to become a coal miner in Wales. And then when the Labour Party was elected, became the Minister of Health. And Bernie said, on July 5th, 1948, in a historic moment for modern civilization, Nye Bevan cut a ribbon, and doctors' offices throughout Britain became available to all without cost to the patient. And he talked about the three principles of the National Health Service. One, that it meet the needs of everyone. Two, that it be free at the point of delivery. Three, that it be based on clinical need and not how wealthy you are. Bernie has adopted the position of single-payer health care and is now campaigning clearly inspired by you, by what you've achieved in Britain across the United States. And he's also looking to Canada's public health care system for inspiration. I think that this is a pivotal moment in history. I've been doing this for 23 years in Canada. We joke that we sleep next to the elephant, next to the largest private healthcare system in the world. And in all those years, I have never seen the movement for a single-payer system in the United States at such a high level. It has swept the country. The political space has been created for a debate about bringing in real public health care in the United States for the first time. It's very exciting, and it's based on your inspiration. In Canada, in 1947, a man named Tommy Douglas, Premier of Saskatchewan, a province out in the prairies in the west, brought in the first universal hospital insurance program in North America. And then in 1959, he brought in the first universal public Medicare program that guaranteed health care to all residents, regardless of their income. Our health system, like many across the Commonwealth and indeed all the public health systems around the world, was inspired by yours, and like yours, has faced the same challenges of privatization, marketization, and dismantling. Our healthcare system has been buffeted by outrageously expensive privatization schemes like your PFI. We have, by and large, stopped outright privatization of hospitals, but we have seen the marketization of the modalities of care. Our hospitals are no longer run by physicians often, they're run by MBAs. Services have been split dangerously into ancillary or non-core services, hived off from what they call the core services, and privatized. Now, I don't know about you, but I know that a hospital can run without a CEO, but not a single patient would survive without patient food, without the porters, without the cleaners, without the transcribers. So I ask you, in fact, which services are core? An army of technocrats, bean counters, consulting companies like KPMG, Deloitte & Touche, PricewaterhouseCoopers, they've descended on our health system like yours. And with corporatization, our wards have closed beds systematically And those same wards have been taken over by new administrators, bean counters, measures of the increasing array of targets and price-based procedures that have been imposed on our health system, and efficiency plans that are run under systems developed by car companies, systems that measure efficiency in throughput and the like, if you can believe, for patient care. And these systems push the limitations on care, changing the way that our hospitals are run and our healthcare system is run fundamentally, working against the core values of equity and compassion, bringing in the inhumane drive to move patients ever more quickly, move them out to less and less and less care. All this is just to say that when you were talking today about the changes in your health system, know that we're facing them around the world. I believe that the antithesis of privatization is democracy. And I believe that the privatization and the marketization of our health systems could not exist if they were not being done under the radar, behind the scenes, in backroom deals, behind closed doors. We have fought the privatization of our healthcare system by forcing democracy on the system when they would not give it to us, taking a page from the civil rights movement and social movements around the world that have gone before us. When they don't want to give it to you, it's ours to take. Our hospitals belong to the people. We fund them, we rely on them from birth to death. They're ours. And fundamental changes to those hospitals and to our public health care system cannot and should not be accomplished without democratic input. Like you in Devon, we've surrounded our hospitals and refused to let them be closed. We've held local referendums to stop the P3 privatization, or PFI as you call it, of our hospitals. We have used that tactic to entirely stop private clinics. We've held public hearings, mass marches, days of action at the legislature in which we bring in busloads of people from small towns where their hospitals are at risk of closure and consolidation into the larger towns. We bring the fight back right to the seat of the legislature. We've brought farmers with their combines and tractors to the front doors of the legislature to oppose the close down of rural health care and to fight back against privatization. Across Canada, a new food fight has emerged to fight back against the privatization of our food services in our hospitals and to insist on the reestablishment of the hospital kitchen with local produce and locally produced food. And through insisting on democracy, through insisting that when they don't give us the right to vote on it, we vote on it anyway. We hold our own referendums. We ask every store we can in town, all the drugstores, all the gas stations, if we can have ballot boxes. We print the ballots, we label them. We have judges and lawyers and city councilors counting up the votes as they come in. We have volunteers staffing the ballot boxes, and we have hundreds of thousands of people who come out to vote against privatization. We go door to door in every community to get out the vote. And at the end of the day, we entirely stopped the private clinics from entering our province in Canada. Our mission, I believe, is to challenge the vested interests that are moving in to take over our healthcare system. It's to expose the purposeful dismantling of public healthcare through starving it of resources first and then privatizing the ownership and control of it second. We must insist that public healthcare reflect the values and the priorities of our communities, that the compassion of our public healthcare systems not be lost to the market-driven competition and the modalities of care that treat patients like widgets. To quote Tommy Douglas, the founder of public healthcare in Canada, he said in response to the first fight against extra billing and two-tier healthcare in the 80s in Canada, he said, "I'm telling you that unless those of us who believe in public Medicare for all raise our voices in no uncertain terms, unless we arouse our neighbors and our friends and our communities, We're sounding the death knell of Medicare in our country, and I, for one, will not sit by idly and let that happen. Thank you.